Thank you so much, panel, for those wonderful examples and giving us a lot to think about in our interactions with the media. And Cece, I always appreciate your crunchiness about takeaways and concrete things that we need to be thinking about doing. So before lunch, we're going to have an interesting second panel here, the power of social media for reaching new audiences, evolving practices, and emerging evidence. So if I could ask the panelists to come on up as I'm speaking. Moderator Michelle Larkin, who is Assistant Vice President, Program Portfolios, Robert Wood Johnson Foundation. Dana March, Editor-in-Chief, the 2x2 Project, Columbia University School of Public Health, and Carlos Roge, Executive Vice President, Media and Content Strategy, Homefront, DC. So with that, I'm going to turn it over to Michelle.
Good morning and thank you, or good afternoon almost, for folks here and for folks on the West Coast. It's almost the end of your day. But stay engaged. We are engaged in a conversation on Twitter. Please participate in that. Please share the information that you're hearing and learning about today. Because what we've heard throughout the morning is that as we're thinking about how we actually shift the nation to really thinking about what it takes to build a culture of health, to make it so that it's not just about our personal responsibility, but that's important, but it's also about our policies and how our community and our personal behaviors and decisions come together to create that health, that economic vibrancy, that ability to have a strong and healthy military, that ability for kids to succeed in school, to graduate, to earn a living wage, to really engage in their community and become civic members that help and business leaders actually have a very viable workforce to draw from and really think about how we can tie all of these things together to really create that shift and to build that culture of health that we're looking for. I'm not talking about shifting culture so that we throw away the wonderful diversity that makes us America, but it is honoring those values, those traditions, but it's also helping people to understand and come together to create a shared vision for what it means to have a healthy population and to make those connections between health and our economic vibrancy, health and our educated kids and families, and how an educated U.S. population helps us to be competitive globally. So these things are all intertwined and interconnected and in some instances interdependent. So we do have a great panel for our afternoon conversation. Dana March is actually here from Columbia University. She's the editor-in-chief for 2x2, which is engaging in conversations to make research and science translated into language that we can understand, and I think more importantly, language that we can act upon so that we know what it is that we should be doing to really create new communities. Because our context that we live in is constantly changing. And so how do we understand our social lives and how where we live shapes population health and how we respond and act on what we understand that context to be. So Dana will be speaking in a moment, and then Carlos Roig. Carlos is the Executive Vice President for Media Content Strategy for Homefront Communications. And he has really emphasized digital content and the importance of creating audience engagement and online community building so that we actually can further the conversation and further the dialogue in our conversation on a range of issues, and particularly on how we actually understand health and population health, which is at the core of what we talked about today. I really appreciated our morning speakers, and they really, I think, challenged our thinking about the value of social media and how we use traditional media and social media to not only advance a conversation, but to get it to stick and to get it to get people to engage and act. So I'm going to call Dana up, and please join us and get your questions ready, because when we come back from lunch, we're going to engage in a conversation.